Hi, in this educational video, I am going to share some insights about the 72-hour process of the Baker Act. In the first video of this series, I shared about what the Florida Baker Act is and who can initiate it. In the last video, I shared about law enforcement's role and the initial process of arriving at a Baker Act facility. Now I am going to give you some important information about what is supposed to happen during the 72 hours and things to keep your eyes and ears open to so that you or a loved one can better advocate for appropriate treatment and a timely discharge. Although a person is not supposed to be held under an involuntary hold for longer than 72 hours, if that 72 hours expires on the weekend or a holiday, then the next working day. Within those 72 hours, one of the following things must take place. One, they must be released outright unless the person is charged with a crime. Or two, be released with outpatient treatment. Or three, to be asked to consent to voluntary placement. Or four, a petition must be filed. Now, when a petition is filed, it must include recommendations from two psychiatrists that have both examined the person in person. Unfortunately, that doesn't always happen. And it is possible that the second opinion will be totally based on the first psychiatrist's opinion and not on an independent evaluation by the second psychiatrist. I have witnessed a psychiatrist go into an isolated room and fill out the second opinion forms without ever seeing the patients, especially the children. So when someone, especially your child, tells you they didn't see a doctor, it's very possible that they are telling you a fact. The common practice for less than reputable facilities is to not discharge patients over the weekend because it is an easy extra 2 days of billable time. Remember that facilities are not held liable for holding patients longer than the 72 hours when the 72 hours expires over the weekend or a holiday. Some facilities may say that they are unable to discharge over the weekend because they are unable to schedule outpatient appointments, therefore not providing quality patient care. Additionally, the second opinion or the second psychiatrist or the weekend psychiatrist is not usually the treating psychiatrist. And therefore they can say that because they are unfamiliar with the patient, that they don't feel comfortable discharging the patient and that they will rely on the treating psychiatrist's opinion from a day or 2 days prior. Now, as a mental health professional, I have been trained to assess an individual's risk level in a relatively short period of time. So then I come to this question. Are psychiatrists also trained to assess risk level in a relatively short period of time? And isn't an individual under a Baker Act supposed to be independently evaluated on a daily basis as part of providing quality patient care? Please comment below and let me know what you think about these questions. Although a person can't stop a Baker Act, they are still able to decline treatment. However, a patient may be made to feel that they can't and that their stay will be extended if they do. This is not 100% accurate. Be aware that if the facility is more interested in quantity rather than quality, they will manipulate the situation to justify an extended stay, such as a staff member may antagonize the patient to elicit a negative response that can be documented and used to justify extending a patient's stay. Or they may use making adjustments to medications a reason to justify extending a stay, especially if adding a medication or changing a medication. Okay, so usually when someone finds themselves in this situation, it's fair to say that they were not having their best day. Obviously, this can be used to the facility's advantage. Pretty much, the majority of emotions that we experience can be documented in a way that can justify a person's extended length of stay. Even being positive and calm, it can be documented that the person is in denial, or that they are lacking insight or awareness, or they are having emotions that are not based in reality or appropriate to the current situation. This makes it sound like a catch-22 situation, right? Well, it doesn't have to be. I'll let you know how to advocate for your discharge in the next video. Many Baker Act facilities provide a needed, productive service to our communities. If a person has a plan to kill themselves or someone else, the threat is imminent and there is no other option to keep them or somebody else safe, then Baker Act is a viable option and it can save lives. And that is the true spirit of the Baker Act. As a patient advocate and having witnessed these unsavory practices, it is my intent to empower you with information. If you find yourself in this situation or a loved one, I encourage you all to find the positive. I believe that everything does happen for a reason, and that we are each capable of turning a negative situation into a positive outcome. So, I encourage you to remain calm and to guard your buttons. The information in this series is intended to assist you and or your loved ones to be able to advocate for a speedy and safe return to your daily life. In the next video, I will explain the difference between voluntary and involuntary status and explain about the writ and the request for discharge. These are two very important tools. These tools have been included in the Baker Act to make sure that patients can maintain their rights and regain their freedoms as soon as possible. When you have an understanding of them, you and or a loved one can take back control of a situation. Thank you for watching, and please hit the like button and share this video with your family and friends. And remember to subscribe and hit the little bell button so you can get notifications on new information. I wish for each of you to be strong and to be well.